Hey, I'm Michelle with Balanced Health. I'm a family nurse practitioner and I specialize in medical weight loss. So, in today's video, I wanted to talk briefly about the most common side effects associated with GLP-1 medications like semaglutide or tirzepatide, and kind of some ways that I typically recommend my patients to try to manage them. Now, only about 25% of people do have side effects, and so they do get a lot of press for side effects, and they can be severe, but typically the only time I've really seen issues with people having severe side effects is if their initial dose was too big of a dose or it was increased too quickly. Normally, the way I do it is I start very low and go very slow, and so most patients, the ones that do have side effects, are typically mild. So the most common side effect is nausea. So starting with a low dose and increasing very slowly will help with that. Usually, after your body kind of gets adjusted to the medication, the nausea goes away. So starting very slow typically really helps with that in particular. There is sublingual B12 that you can just put the drops under your tongue. That's helpful. There's some peppermint anti-nausea things. Some patients have told me they've gotten like at Walmart that they found helpful. Sometimes just eating a little something, a couple of crackers, almost like for those who've had morning sickness, similar to that. And then occasionally I call in a prescription for Zofran for my patients if they're really just struggling initially. Doesn't happen very often, but that is an option for the nausea as well. Also, another common side effect is indigestion. So be sure that you don't overeat. And sometimes when you first start on these, you're going to realize that it's just habit to overeat. And once you're on these, initially it can kind of be a shift into relearning how much you should eat. So I have had patients, I myself have done this too, where I was used to being able to eat a certain quantity of food and just kind of out of habit, just kept eating. I grew up in the area where you have to clean your plate and you can overeat and it just won't fit anymore. You'll be very miserable and sometimes you will even throw up. So try to avoid overeating. It's better to eat slowly so that you give your brain time to realize that you're full, especially at the beginning when you're getting adjusted to these medications. Also, you want to be sure that when you finish your meal for the end of the day that you're giving yourself at least 2 hours before you lie down in bed. So that's just good for any reflux, but you want to be sure that your food is mostly digested before you lay down. So that typically will help as well. If that continues, or I have patients that burp a lot or have sulfur burps that are terrible, I didn't have those, so thankfully, but I've heard they sound terrible. So a lot of times a probiotic will help with that. It can be an indicator that you got some bad bacteria brewing in your gut and you need to adjust the balance of those. Fatigue is common at the beginning as well, especially with the semaglutide, not as common with the tirzepatide. Uh, but it is common, and it sometimes can go on for a while, especially like you take your injection maybe the day or two after you're pretty tired. So you want to be sure you're drinking plenty of fluids and also make sure you're really getting enough protein. If you're not giving your body what it needs, then you're really going to feel exhausted. So those are the things that I recommend for fatigue. Um, Headaches can be common, especially at the beginning as well. So again, make sure you're drinking plenty of fluids. Dehydration can cause headaches, and then if you're already prone to that anyway, make that worse. So make sure you're drinking plenty. And usually that's not terrible headaches. Usually just some Tylenol or ibuprofen, something like that, is enough to handle that. And then another common side effect is constipation. Now that's when most of these will go away. As your body gets adjusted to the medication, most of these side effects will go away except for constipation. The constipation is due to the slowing of your digestive tract. That's one of the ways the medications work. Slows your digestion down so you simply can't eat as much. It won't fit. So you feel full sooner and you feel full longer. But because of that, that allows your body more time to absorb water from your stool. So that is a side effect that is common, and it's common to have it the entire time you're on the medication. Occasionally people will have diarrhea, but that's not as common, and it's usually it's linked more with something you ate, something not good for you. But constipation is super common. So again, you want to be sure you're drinking plenty of water. Often, even drinking plenty of water, it's still not enough. You may still have constipation. So it may not be fixed or fixable just with water intake. I usually, with my patients, will recommend making sure they drink plenty of water, just a simple stool softener like a Ducalox that's over the counter, that you can get at Walmart or whatever. Those often are helpful. Miralax usually works pretty good for most patients. Again, you can get that over the counter. There's also, it's not a laxative, it's like a detox agent called Mag07. I learned about it from Facebook group with other patients that are on GLP-1s and constantly talking about this Mag07. It's kind of a detox agent, works very well for the constipation. I've had several patients that take prescription Linzess for constipation and then still needed this on top of it, and they felt like the Mag07 often worked better than the Linzess. So you can just order it from Amazon. I think it says you can to start with 3 capsules a day. I always tell my patients not to do that much because you could be on the toilet for a very long time. So I usually like to err on the side of caution, do 1, then wait till the next day, see if you've had any results, and gradually, adjust it. But that's something you'd want to talk to your provider about. Um, but those are typically the things that I recommend for my patients, and those are the most common side effects. Again, typically they should be very mild, especially if you're starting with a low dose and not overdoing it and going very slowly. So if you have any questions about any of that, just let me know below, and I'll link the Mag07 down there too for anybody who's interested in looking at that.